It was a great San Antonio. There were lots of really interesting presentations. There were presentations both in early stage disease and in metastatic disease, as well as some of the risk, as well as local therapy. So there were lots of interesting presentations. I'm a medical oncologist, so it's always great for me to go to San Antonio because it's such a multidisciplinary meeting. So there were a number of really interesting presentations on the omission of sentinel node or axillary node dissection and the safety of it. But then, how does that affect us as medical oncologists if we don't know the sentinel node status? So there was a great session discussing some of the issues that affect the radiation oncology recommendations and systemic therapy recommendations if you omit a sentinel node that we now know for many cases is really not necessary therapeutically, but just for giving prognostic and predictive information for the other modalities involved in the treatment of breast cancer. There were some exciting presentations about some of the new oral SERDs and some of the new oral SERDs in combination with a variety of targeted therapies. Is something we've been waiting with a while now that we have these data on oral SERDs and we have all of this data on targeted therapies, actually getting some data on combining the two together. There was a really exciting presentation on the role of CDK4/6 inhibitor of Palbociclib given in addition to trastuzumab and HER2-directed therapy in maintenance first line, where it made a huge difference in terms of prolonging survival. So I think there was just a lot of interesting data presented at San Antonio that I think it's now just, the Monday post San Antonio, and I think we're all just still parsing through some of this to try to figure it out. But certainly the data from PATINA, which was showing this incredible benefit of adding Palbociclib in addition to endocrine therapy, in addition to HER2 targeted therapy in the maintenance phase, I think that's practice changing. I've gone back, I've thought about the patients for whom it may apply, and it's something that I'm going to do differently today by virtue of having been at San Antonio.